Voices for Autism series, and we have today's conversation a very important one. We are joined by Madam Olukitibi, and we already started the conversation. So if you're just joining now, you're a bit late, but you've not missed much. We started the conversation, but we do not have the best network reception no matter the time is end. Today's conversation is titled "Invisible No More." We are addressing autism in women and girls to commemorate the International Day of the Girl Child, which is in 2 days, on the 11th of October 2025. It's a very important conversation, and as Madam Dami already initiated, she already made mention of the fact that the CDC already recognizes that autism is more prevalent in young men than in boys than in women. There's a ratio of 3 to 1 when it comes to the accuracy of early diagnosis. We're getting into much of the conversation, but a quick rundown on what the Lend Your Voice 1000 Voices for Autism represents and how it is brought to you. So, the Lend Your Voice 1000 Voices for Autism is an avenue for us to have conversations about autism, to implore the importance of autism advocacy. We use this as a medium to ensure that these conversations are had, to advocate for people living with autism in Nigeria and across Africa at large. It's brought to you by the AK Foundation for Autism, and it's our own little way to ensure that we kill any form of stigma, we rearrange and reset conversations that are negative, that represent as negative stereotypes. We are here debunking myths and hosting a whole lot of people who have shared experiences with autism and how they navigate it. Today, we are joined by Madam Dami, who's a special education needs therapist and an absolute astute professional in the autism space, and that is why we're having a conversation to commemorate the International Day of the Girl Child. Would you
Epic,
say?
are you there?
Yes, I am. Yes, I am. Can you hear me?
Epic, can you hear me?
I can hear you clearly, madam. I can hear you clearly. Absolutely. Loud and clear, I can hear you.
Okay, great. Okay, great. I think I'll just take it from the last thing I said, and then you can repeat your question. I wasn't sure I heard the question you were trying to ask me.
Oh,
We've talked
yeah.
about the data of ratio of boys to girls, and I went further to say that it doesn't mean that girls are less autistic, right? It just means that they aren't accounted for, So we see each day we come across girls who have autism. And truth be told, even in real life, we see more boys than girls, right? To what do we owe this data that we have? I would say that based on research, right, I would go back to the diagnostic tools that we have, the diagnostic tool that we use at the point of research where these tools were being put in place, they worked more with boys, right? And then the data that it got from the research and then that comes to us putting in place these tools were more boys centered. I mean, so we then can tell why we have more boys being diagnosed as against girls being diagnosed because when they were putting together these tools, they looked at it more from the view of the boys more than the girls. So it measures boys more than the girls that we have, right? And also that some of the behaviors that girls um would
Exhibit.
display will display or exhibit could seem more socially appropriate. So we're not seeing the struggles, we're just seeing that, oh, they're able to do this, so they're fitting in. If they're fitting in, then that's fine. We're not looking at the underlying struggles because girls are able to copy more, girls are able to imitate more. Okay, so I mean, let's take for instance, right? You would see a boy child arranging toy cars in a pattern, right? And then over time, they do not outgrow this behavior. They keep arranging the toy cars. At this point, we know that okay, if this child is arranging the toy cars in this pattern, maybe it doesn't fit what's supposed to be done. Instead, you're supposed to be moving around with the car. You're supposed to be driving. You're supposed to be doing this. So it's easy for us to flag that. But when you see a girl child arranging their, let's say, their kitchen toys, they're arranging their dolls, that seem more like something a girl would do. So we wouldn't then count this to be a challenge when it comes to a girl child. But for the boy child arranging cars, it is easier to flag. Look at that kind of example and many more
Example. Yeah.
examples that will be happening with the girl child that we would see and say, oh, girls are neat, girls want to have their things in this way. So yeah, it's okay. But when we come to boys, we don't see it as something that is okay. So that's one example I can cite. And if we see it from that angle, it will be able to understand. Yeah.
A very brilliant example there. I think I genuinely agree with that because it already tends to show the disparity in character traits when it comes to boys and girls. But you said
Mhm,
something very interesting, which I agree
mhm,
with. Research has shown that a lot of the early research that happened at regards or with regards to autism was tested on boys. Would you say
mhm.
this has affected the accuracy in diagnosis today?
Yes, it
And would you
has.
also secondly, would you say that would you say that autism early diagnosis in girls is not as accurate as it should be because all the early research that surrounded early diagnosis were tested majorly on boys?
It has an impact. The research that were done earlier that were boy centered has an impact on how we diagnose autism in girls now, because it's like a boxes. It's like boxes that we tick, right? So if we're going only by those boxes that we tick, yes, it will affect the outcome. We're looking at it and we're saying we're cross checking scores, and we're saying in these scores this is what this boy has gotten. And looking at the DSM or other criteria for autism diagnosis, you have to meet a certain number, right? You have to have a certain scores to qualify for autism diagnosis. And if we're using these test scores for girls and they don't meet up to the scores, then they would not be diagnosed to be on the autism spectrum.
Okay.
So yes, it does impact diagnosis now. However, something that is good that is happening now is even beyond the diagnosis. Or I would say for my practice, for instance, I'm looking beyond the diagnosis. I'm looking at the struggles really. What are these children struggling with? What are they finding difficult to do? Right. And then that way we're coming in with intervention, we're coming in with help more from that angle of challenges rather than the boxes that they tick.
Absolutely, brilliant one. Absolutely amazing suggestion. We have identified that there are certain character traits that the boy child would exhibit that is totally different from how a girl child will operate. Let's talk about autism presentation now in these young people. What are the specific differences that you have noticed that in the way autism presents itself from the girl child than the boy child? And how can parents observe better?
Okay, so for instance, you can see a girl, right, who is in a social setting, for instance, and is not necessarily interacting in the social setting. People would definitely look at it and say, oh, she's just being shy. Or you know how girl children can be. They want to be savvy and all of those things. It can be categorized under those components. Meanwhile, for boys, we typically know that boys can be all over the place and then want to get into conversations and the likes. So if a boy child is not doing all of those things, it is easy to pick up on and say, oh, he doesn't interact with the environment, he doesn't do this with the environment, people are there, he just goes past them. That's already a red flag. But for a girl child, we can say, oh, girl children don't necessarily want to get into conversations and they don't want to get there. And because of this, it's okay. Especially if the girl child is able to look into the environment and imitate. Let's say people are laughing, the girl child is able to laugh, not necessarily getting the joke, right?
Joke.
But because they saw that people are laughing and they laughed, we assume that they are following the conversation. When
Conversation.
they do not get the joke, they've just been able to read people's expression and emotions and run along with that. You understand? Because I mean, for autism presentation, it presents itself in four different domains, right? Our ability to communicate, our ability to interact, the behaviors that we exhibit, and then our sensory needs, right? For a girl child now, like I said earlier, they can camouflage, right? Even for special interest, for instance, a girl child is in the setting, right? And if a conversation is set on something that interests them, sure, they will flow along in this conversation,
According
right? They'll flow along in conversation. You wouldn't then think, oh, I mean, oh, this child is able to converse, this child is talking about this, talking about that. Then for us, it dismisses whatever challenges they might be. We would then tag them as being normal. Oh, their interest is typical and they are able to converse in that area of interest. Meanwhile, we are not looking at if we get into something, if we try to change the conversation, if we try to go into something else, this girl child is always finding a way to bring us back to their favorite topic. But a boy child who is in this setting, right, and is not able to converse in line with what the interest is at the time, it is quickly flagged because we expect that, oh, girl child should be able to touch and boy child should be able to touch on different things, but at this time they're not touching on these different things. We're able to quickly say, oh, this person is socially awkward or socially weird and all of those things. You understand? Unlike a girl child who will be able to mimic these things. And some girl children will not necessarily want to make friends as much as a boy child will want to do.
Culture.
Boy children will be in an environment and they can just go off and talk to anybody, play with anybody. But we're used to the fact that girl children sometimes take their time and then so we assume that when they're in these settings they are taking their time, or maybe they don't see anyone they like, maybe they don't see anyone whose interests match their interests, and then we just continually say, oh, this is fine, this child is just an introvert, this child is just not someone who wants to engage in the
Person who
environment.
wants to
Meanwhile,
engage.
they're overwhelmed. Meanwhile, they're overwhelmed, and this is why they're refraining from engaging in conversation. So, I mean, I could go on and on and on, speaking about these different things, really.
I think I appreciate how you have addressed this, and I want to follow up this conversation with a very simple question. Now, this social camouflage that is common
Mhm,
with girls, right? It's
mhm.
something that it's spontaneous. It's not rehearsed. This happens naturally, as you said. It's a lot of imitation with respect to their surroundings. How would you say what effects, positively and negatively, would you say this has on the girl child long term? Her mental health, her interaction in public conversations long term. This consistent attitude of camouflaging or trying to imitate without fully understanding, do you think it has a negative or positive impact on their mental health and growing up generally?
It does. It does have negative impacts, right? Yeah, the positivity is that, oh, maybe they're able to mask to a reasonable extent, right? They're able to fit in at some point. But do not forget that while they are fitting in, they are gradually losing themselves in the process because each day you are acting, it's like there is really no day, there's no downtime for the girl child to let loose and just be themselves because they are constantly trying to fit in, they are constantly rehearsing things, looking into instead of enjoying the moment, they are constantly picking up on things, trying to imitate this, trying to do this, trying to do that. It becomes overwhelming for them, it becomes draining for them, and then it gets to the time where they can't bear it anymore, right? They just let loose. Do you understand? So when they find themselves constantly masking, yes, to a certain extent they enjoy, people saying, oh, they're fitting in, they're doing this, but underlying struggles are there, they become overwhelmed, and it could get to a point where they just shut down because everybody has their breaking point, right? It gets to the point where they can no longer go on. It gets to the point where it is overwhelming. It gets to the point where they say, oh, you know what, this is it, and then they withdraw. When you are used to being able to do something, and at this point you can no longer do it because either tired or you're overwhelmed, you can't bear it anymore. They walk into their shell, right? And then they would rather not engage anymore because they've done it over time and now it's stressing them out. They just withdraw, go into their shell, and then it could even lead to some anxiety disorders, right? Where they then find themselves in this situation, they remember all the masking they've had to do, and they are anxious. They are anxious. It is now very stressful for them. It can even lead into personality disorder, right? Where in one place you're having to behave this way, and in another place you're having to behave this way. You're kind of not sure of your personality anymore. So beyond the autism now, we are going to be having some comorbidities, right? Coexisting challenges like anxiety disorder, personality disorder. I mean, the list is ended. There are definitely consequences, and I think it outweighs the advantages, if you ask me.
Well said, well said, absolutely well said. And this, I think, another damage this does is the inability. It suppresses the ability to express themselves. Would you agree with me?
Exactly.
In
Yeah.
case in situations where they find things uncomfortable, would you say that affects their ability to express themselves and say things displease them as they should when they feel some certain level of displeasure?
Yes, it does. It causes them to lose their ability to advocate for themselves, right? Because you want to fit in, because you want to be able to do things the way the society says this is what should be done. You then will lose your ability to advocate for yourself in a situation whereby something isn't going well. You're supposed to be able to say, "Oh, this is not what I would do. I would want to do right now. I would rather be doing this. I would rather be doing that." So they kind of lose themselves in the process. They can't advocate for themselves. They will not be able to say when they don't want to be in a space or they don't want to do something anymore. So yeah, I agree with you. I agree with you.
Madam Dami, what would you recommend that parents, caregivers can do when they notice this consistent suppression, this consistent social camouflaging, this consistent imitation to ensure that it doesn't continue in the girl child? What would you recommend? What are the certain activities parents could put in place to ensure that this is caught before it starts to foster properly?
Okay, so I would just take it from the last thing I said about self-advocacy, right? First of all, we want them to know themselves, right? We want to call their consciousness to self. Self-awareness is something we want to start teaching. And I say this for even children who do not have autism. We want to look into self-advocacy, labeling emotions, right? Understand, acknowledging your emotions and being able to speak to it. It starts from as easy as teaching a child to say when they're sad, when they're happy, when they are excited, labeling those emotions and acknowledging that it's okay that I feel this way. So if I agree with myself that it's okay, then it's okay for me to share, right? Going from that angle. And then parents should always trust their instincts. It's easy when you think something is not going well, and then you go for a diagnosis, for instance, and then they tick those boxes and they tell you, "Oh, everything is fine. Don't worry. This child will go past this." As a guardian or a parent, whatever, trust your instincts. Acknowledge that you are seeing these challenges and go the extra mile to ensure that your child gets the needed help. Teach your children to advocate for themselves. That if you are in a situation where yes, you are expected to behave in a certain way, but you can't because of whatever reasons, be able to speak up for yourself and let people understand that this is how you feel about this situation. I would think that that's the first step. When they start speaking up for themselves, and it is easy for us to then get into their mind and understand how different situations or different occurrences makes them feel and then walk them through navigating these situations.
Brilliant, brilliant, absolutely brilliant. It's important, as you highlighted, um, from an early age, identify those feelings, be able to express it, and all that, and it matures into that. You said this consistent anxiety breeds some certain level of um, anxiety, comorbidity starts to occur when it comes to the girl child. We know that sometimes there's a lot of misdiagnosis when it comes to the girl child for different reasons, right? A lot of people say when it comes to autism, as we had highlighted earlier, it's because of a lot of the early diagnosis was conducted on boys. For some other reasons, it's because of they possess this other characteristics that might cause some certain level of misdiagnosis. So autism is being diagnosed as ADHD or some certain level of anxiety. Please, I would appreciate if you highlight these comorbidities and what is peculiar to all of them so our guests and listeners can fully clearly understand the differences from autism, ADHD, and what they should expect when they see it in the girl child.
Okay, so for autism, right, like I earlier said, it affects four domains, right? Communication, ability to communicate, and communication is at different levels. For some children are non-vocal verbal, right? It means yes, they communicate, but not with the use of words. Some have the use of words, but a little bit delayed, right? So let's say that one word it's words, right? Some can't make sentences, and then some who can make sentences can have back and forth conversations, right? And for some
Mhm.
who can have back and forth conversation, it can be rigid to some particular things. And for some that are not rigid, it is only rote learning. So let's say something they've learned over time, that's what they can keep doing. They might have difficulty constructing new sentences on their own. That's the communication bit. Some are non-vocal verbal. Yes, they can communicate using gestures, they can communicate by hand leading, they can communicate in their different ways, but not without the use of words. We also have the social interaction bit where some children find it hard to interact in a social setting. Yes, and that's at different levels as well. Some will be able to tolerate parallel play, right? Where other children are playing beside them, but they will not necessarily have any interaction with them beyond you're just next to me playing, right? And then some children can, have some level of play, but might have difficulty sharing their items with the other person. You could even see a child who wants to interact now, who will go to push, for instance. Most times that is being tagged that, oh, this child is being aggressive and the likes. But over time, what we have seen is that is the way the child is initiating their own interaction. What you're saying is, oh, I want to play with you. Oh, let's play the chase. Oh, tag, right? They are interacting, but in a different way, right? I also said that some will be fixated on a particular topic. Yes, they are interacting, right? But when we're interacting based on my preferred interest, if
But
you go into something that doesn't interest me, then I'm not interested in having this
every conversation.
interaction. For some children, the behavior, they have rigid or inflexible behavior, right? They would rather do one thing, which is where for a girl child who likes their room properly arranged, who would arrange their chairs, arrange their clothes, arrange everything, it seems good, right? We all like it. We think it's a good thing. Your room is neat,
Yeah,
but it could be a sign of autism where this child who can't tolerate the trousers being where the skirts are, the dresses have to stay in the dresses. But we know that sometimes in life things can change, right? Where you can't
yeah,
have it that way. Their inability to entertain this flexibility is something we can be looking out for. And then some children will follow a non-functional routine. So let's say that a child believes that if I want to have my bath, I have to brush first before going to have my bath. There will be situation where you have your bath, then brush. So they can't tolerate this
it's
routine. And you
flexibility.
think
Yeah,
about it, it is non-functional. What is important is that you take those steps,
you
right?
see
Regardless of how you go about it.
which comes
We've
first.
even Exactly. We've even seen a situation where children know the route to their school or their home, and if there's a reason for you to change route, then it could interrupt their day, and then we have the outburst, right? We also have the sensory seeking part where we have the audio, right? Some children cannot tolerate noise, right? Let's say they're in a room and the AC is on, but they can constantly hear the sound of the AC, then it irritates them, right? For some children, it is touch. They cannot tolerate you touch. You would probably want to come to them and want to hug them. That's going to interrupt their and then they're going to have a serious outburst. So for anyone to qualify for autism diagnosis, they have to tick two or more, right, in these domains. If a child is ticking boxes in just the communication and let's say the social interaction, but not having anything in other places, then they do not qualify for autism diagnosis, right? For ADHD is in three domains, right? We have the impulsivity, right? We have the hyperactivity, and then we have the inattention and lack of focus. So if someone is just impulsive and is not hyperactive or is able to focus, then that person cannot qualify for ADHD
Okay.
diagnosis. And people, you
Okay.
could be wondering, what do I mean by impulsivity? Some people do things before thinking about it. The typical order is that I think through things before doing it. I've seen a child who goes into the store and takes things, right? If the child, because they feel like, oh, I want this thing, they just take it. Meanwhile, for typically we would think, I want this thing, do I have the money to purchase this thing? If I don't
Yes,
have the
yes.
money, then I have to wait to get the money to be able to purchase. But for someone who ticks the box of impulsivity, they want the thing and they just take it without thinking it through. That's one of many things. Or someone just says things exactly the way it comes to them without thinking about how best to put the word out there, how it makes this other person feel. That's impulsivity, right? Then hyperactivity is the constant urge to find yourself doing something. You want to constantly doing something. You can't take a break. if you're not doing something, then it's it makes this individual uncomfortable. That's where their
Comfortable.
activity will be, and that's why we see children always on the go, getting up and going, and then you're thinking, why can't you just sit down for a minute? Because the adrenaline is, it's out there. I need to keep
The roof.
doing something. Exactly. And focus or inattention. So you see, something around focus or inattention that I've seen over the years is people actually think that individuals who have ADHD cannot focus at all. That's not true, right? Yes, they have issues focusing and attending to things, but when it is something that interests them, they are able to stay on that task. They're able to do it. But when it goes completely out of their interest, then it becomes hard. The difference is that for some of us, even though it doesn't interest us, we understand that at this point I'm supposed to do this, right? And then we tolerate it. But for individuals who have ADHD, they can't tolerate. If it doesn't interest them, then it is hard for them to attend to it. It is hard for them to focus on it. So for someone to qualify for ADHD diagnosis, they have to tick boxes from impulsivity, hyperactivity, and inattention focus. So those are differences. I get that sometimes children who have autism can be hyperactive, but only hyperactivity would not qualify this child for ADHD diagnosis. Yeah.
Lovely. I completely love that one. Very specific, very detailed, and very explanatory. We've been on here for quite some time. I want to admonish, if you have questions for Madam Dami, please do also send them in. We'll curate them by the end of the conversation. We'll throw it to her, to all our listeners and viewers across all our social media platforms. And then we'll get straight into the growth process. We are not going to talk about autism in girls and women without addressing the impact of puberty, adolescence, handling when it comes to autism. Let's talk about that for a bit. How does puberty and adolescence uniquely affect a girl child with autism? We're talking, how does it affect their sensory capabilities, their emotional capabilities? Let's get into that conversation for a bit.
It absolutely does. It does affect. So, I mean, it affects everyone really, right? The difference is ability to communicate how you feel, right? Ability to get feedback to say, oh, let's say someone explains to you and you understand it, right? But for children who have autism, that's a little bit different. It's a little bit different. They're feeling this way and they do not understand why they're feeling this way. They can't pitch, they can't pitch the emotional outburst, and they can't link it to this
To a particular thing.
biological or physiological feeling going on in them. They can't link them together. They don't understand the linkage. And the way they feel, they act it exactly that way. So it does affect them. At this time, they are more sensitive. At this time, we have more emotional outburst. One part will be the process that goes into it, right? Some of them have little threshold for pain. So imagine, for instance, in girls' menstruation, right? Where you have the cramps and the likes, it's upsetting that you're feeling this way. Why am I feeling this way? Why do I have to go through this? And then they just express it exactly the way it feels, not in the way that we would rather think they should. Like, let's say they will come to the adult in their life to say, oh, my stomach hurts or something. They're not necessarily saying my stomach hurts. And for some of them, the pain is aggravated. So let's say it's just, look at my finger. Let's say the pain is like this. For some children who have autism, they feel the pain like this. Imagine if you're feeling a pain like this. How do you want to calm them down? How do you want to let them know this is okay? You can say it is okay, but for them, what they're feeling right now, it's not okay. And it
Not at
just,
all.
exactly, it just sends them into this mode that can be hard to put a word to. And for some of them, even though they are not feeling that way, it sends them into their shell, right? That this period, they don't tolerate anyone coming to them or touching it. They can't stand it, so they would rather withdraw into their shell. So for children who have autism, it is either over or completely under. So it affects them that way. And that's for the girl child. For boy child, in recent time, we see boy children engaging in, and we know that it is response to hormonal changes in the body. We're constantly having issues where we're seeing boy children grinding, getting into this art. Is because they don't understand what's going on inside of them, right? And this is how it makes them feel. They just do exactly how it makes them feel. So there are challenges that puberty really poses on individuals who have autism. Really, there are challenges, and some of them are the ones that I have mentioned.
Yes, you have. Yes, you have indeed. Yes, you have indeed. Particularly at this stage, how would you recommend caregivers, parents, therapists to help young girls who are just about to enter or are already in the stage where it's puberty and adolescence? How do they manage societal pressure, particularly? Because at this stage, it's common. Some of them are in school, some of them are now going to churches, they're in public a lot. And as you have mentioned, there's a lot of reactions that are going on, which are, when it comes to people living with autism, extreme. But this needs to be contained. So, how would you recommend that parents teach their young girls how to manage their emotions in public, around people, in gatherings in societies?
Any day, anytime, right? I would say early intervention is important. We understand that autism poses some form of delay in processing and the like. So we advise that we start teaching early, right? So if it's going to take a while, they would know that we have started teaching it early. And remember, earlier I also talked about teaching our children self-awareness, self-advocacy, emotions, right? Helping them understand their emotions. I want to believe that if they understand their emotions to an extent, we can start linking these possible changes to different emotions, right? Because it's difficult for them to communicate how they feel. But if we start helping them put a name to it, if we start helping them label these emotions, then it is easy to communicate it when you are in a setting. So let's say, for instance, a child is going to school and they're not really feeling great. They will be able to say, "Oh, I'm not feeling great," and then so people can know how to navigate around them. Because I mean, that's what happens with the neurotypicals, right? We can go in and say, "Oh, I'm not really in the mood at this time," or I'm not for it at this time, and then
No,
people
no,
can just respect your privacy or just let you be, right? If we teach our children this way, and it doesn't have to be lots of words. We have something we call zones of regulation, right? Where the green zone says that's okay, the red zone says no way, orange zone, in between. So if we even use color coding and likes, where some in is in I'm in a setting, I can bring out the red card, and then everybody knows this red card is, let me be, stay away
let
at
me.
this time or something. It makes the stimulation lower, because what's happening is there are different stimulating, factors in the environment, right, which can irritate individuals living with autism when they're in this situation, and then causes some level of outburst, right? So if we can limit this stimulating events, then we can limit the sensation that they get from the environment or even from the. Also, right, we also have to teach coping strategies, right? Control. So for things that we can't control from the external factors, we have coping strategies where they can always you say, if you're feeling this way, these are things you can do. If you're feeling this way, these are places you can go to. That way it helps, at least put whatever the situation is into a
Oh,
balance.
okay. I was asking, would you say that there are particular therapeutic interventions that are more efficient on the girl child with autism than on the boy child with autism?
Um, I wouldn't say that at this time, right? But maybe after this show, I would dig into that to find out more. I wouldn't say that at this time, but any therapeutic intervention is used in line with whatever the challenges the individual might be experiencing. Do you understand? We tailor interventions to the different challenges that the individuals are experiencing, regardless of the gender.
Well said, madam. Well said, madam. Let's get into education and inclusion for autistic girls. How can schools, institutions, schools particularly, because I want us to schools particularly because I want us to.
Sorry, please.
Yes, yes. Schools. I was saying let's move on to the education and inclusion, particularly schools. I want us to talk about how schools can do better because for this stage, for the early stage in girl child, it's probably secondary school stage, primary school stage. What would you recommend as inclusive practices that schools can implement to accommodate the girl child living with autism more efficiently and effectively?
So are we asking in relation to puberty or general?
Generally, girls living with autism, yes.
Okay.
How can
So what I would say that is inclusion generally, right, is to ensure that every child in the school has access to everything that is in the school, right, regardless of your condition, right? So what inclusion would mean for me in a school is that the school makes the environment accessible for every child that works in, make learning accessible for every child that works in, adjusting learning to their individual learning style, right? Be it a boy or a girl, make learning adjusted to their learning style. And that's something I've always spoken to say make learning multisensory, for instance. I know that in schools we're used to doing, I stand there, I walk, stay in front of the board, and then you're drawing a board. But some of our learners don't learn that way. They require you to go outside, show them things actually outside. They require, to be able to touch. Some are tactile learners, some are visual learners, some are auditory learners. We implore that schools makes learning accessible in these different means to ensure that every child in the classroom access that learning opportunity. That's something that we say to schools. And to say that everybody in the school is accommodating for these learners, because that's also something that we see. Students in the classroom don't understand this learner in their classroom. We want to ensure that the school sensitizes everyone in school and make them know the possibilities, the possibilities of anything that could happen. So they are aware and there's no teasing, no bullying, they understand. And even if they can't help, they refer to adults in the environment that can help this child in their classroom.
With regards to adolescence and puberty, do you think there are ways that schools can make the environment more accommodating for girls who are going through that stage and still living with autism?
Yeah, yeah, they can. So there are ways actually creating safe spaces, creating safe spaces for them to go to when they're feeling overwhelmed, right? Making it possible for them to speak to someone about how they feel. And then I've been teaching even about these topics in the classroom, speaking to them about these topics so they know it's not weird, it's not particular to just them, because something also could be that they don't know that it's something that every other person in the classroom is experiencing. Puberty happens to all. So speaking about it openly in the classroom space so they know that it's something that everybody in the classroom is experiencing. That way they don't feel extremely different because they already feel different, right? So speaking about it openly, making spaces available if this child is overwhelmed by the stimulation environment, making sure that there are spaces they can go to without being bothered. They understanding the time and season in their lives as well. So it's easier for them to cope in a school setting.
Well said, madam. Well said, madam. We've been on here for a while. We'll breeze through a few of the final questions so we can let you go as quickly as we can. We genuinely appreciate your presence here. I wanted us to talk about the importance of representation. Now, there's a lot of conversation that has gone on about encouraging this girl, self-advocacy and all that. But we would agree that a lot of people, especially young people, children particularly, learn from what they see. People that have gone before them, role models, and all that. How important and how much impact would you say representation has? Older women, adult women living with autism, people would experience having this conversation, advocating for their voices. What would, on a scale of 1 to 10, how important would you say it is, and what is the impact, and what's the impact you say it has on these young girls?
I would say that 10, it's very important, 10, so that the girls can see the possibilities, right? The girl can see that even though I'm living with this condition, right, there's still a possibility for me to navigate these challenges, because they've seen people who have gone ahead of, who have navigated these same challenges, who are able to still live their life, right? I believe that it plays an important role in their life, and then it helps them be willing, to go through the process also, and then hope that they can join the train of women who have gone ahead of them, who are now advocating and be able to advocate through their challenges, because these challenges differs, right? That the women are sharing their own doesn't make it uniform for everyone. It means that they also, when they come to speak up, they would be impacting others as well.
Well said, madam. Well said. Very important. I love how you have highlighted and placed the importance of this kind of conversations at a 10, because, as you said, people have to look forward and see that people have gone before us and recognize that we are not alone. People have done this and aspire towards doing that. We talk about family and environment, community, society. They play a very important. There was a particular writer that once said that we're all as good as our environment. So we recognize that the environment plays a role in the molding and shaping the lifestyles of these children. What can we do better as a society, as family members, because family is the foundational unit of everybody's growth, as family members, as the environment, as society? What can we do better to ensure people, young girls living with autism, maximize their fullest potentials?
Educate ourselves, very important. If what we don't know, we cannot understand, right? Striving to know more, educating ourselves so that when we see these challenges, we can acknowledge them. We can tell the difference between a child just being, spoiled, as they say, or tagging a child's behavior to bad parenting. If we inform ourselves, if we educate ourselves, then we'll be able to veer away from addressing everything as bad parenting or as a spoiled child, and then be willing to help the child in environments. So let's say a parent is out there struggling with their child, you in the environment who understands today can step in and support the mother at this time, can step in and support, even while the mother is trying to, work on whatever it is that they're working, you're advocating on their behalf. Let's somebody say, oh, say, you're able to speak to them. Oh, no, 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 that's not it. This child has autism, this child has these challenges, and that. So, for instance, if a child goes into the supermarket, for instance, and exhibits a certain behavior, maybe before people start coming and say, because you know better, you'll be able to say, oh, no, 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 let's take it, let's wait, let's check this. I'm seeing this, I'm seeing that. It's possible that these are the challenges of the child. And then that way you have also educated someone else in the environment. That way you have also, empowered somebody else and save the dignity of the child in question, right? So it makes it easier. Also, we've had situations where children go missing, right? And then we're looking for their faces everywhere. We're asking for, they say, oh, if the community is well aware, we're also looking out for children that we see moving around. We are quickly able to flag to say, oh, this child who is doing this, someone should check on. You understand? Someone should check on the child. Someone should look at the child. I mean, we cannot overemphasize the positive impact it will have when the community, the family, everyone is on board on the issues of autism. Yes.
Thank you so much, Madam Dami. This has been. I always love having these conversations with you. You are a wealth of knowledge. I come here, my pen and paper, I take notes, and I learn so much. It's the International Day of the Girl Child. Final words, Madam. What are we saying to therapists? What are we saying to educators, to parents, caregivers, to help ensure that these girls living with autism maximize their fullest potentials? Any final words from your end, Madam?
First, that I would say to parents is trust your instinct. Even if they do not meet the criteria for diagnosis, but you are the mother, you are the father, you can tell that this child seems to be struggling with something. Get help as quickly as possible, regardless of what anyone says. This is what I always say, that you get help now, there is no harm in it. If you get help now and then eventually discover that this child does not have autism, you haven't done any harm, right? You have only equipped the child even furthermore. So get help as soon as you can, regardless of what the diagnosis says. For educators, let's look out for the girl child in our classroom. Let's look out for things that we think they're supposed to be doing and they're not doing. Let's quickly step in and help. Let's prepare them for puberty as early as possible, because it can be very challenging. So let's start teaching it early. Let's start advocating for that girl child in your classroom early, because if we do it earlier, then it is easier for them when they get to that stage. And for the community, let's educate ourselves so that we can speak, so that we can support, so that we can, render all the support that we can when we do find ourselves in that environment. Thank you.
Well said, Madam Rami. Thank you so much. Happy
Thank
International
you
Day
for
of the Girl
having
Child in
me.
It's always our
Thank
pleasure to
you.
have you on here. And to all our guests who have
So
joining us, who have joined us here at this conversation, we see your messages. Thank you so much for being part of this. It is Lend Your Voice 1000 Voices for Autism, probably brought to you by AK Foundation for Autism. Madam Dami, we see that you have to run, so we will wrap up immediately. So thank you so much. Thank you. Till we catch you
thank
next time,
you.
ladies and gentlemen. It's epic. Bye bye.
Bye.